The Core 360 belt is the best aid to train the abdominal wall. The Core 360 is a patent-pending, first-of-its-kind training belt that helps you move, breathe, and perform better. We use the Core 360 belt with almost every patient at Winchester Spine and Sport. The biofeedback is second to none, and it's an amazing way to teach proper respiration and can be even used during higher-level movements in the gym. Teaching proper respiration is about as fun as a rash, but with the Core 360 belt, you take all the headaches away. Visit core360belt.com and use the code GESTALT for 10% off all belts, OhmTrack sensors not included. Again, visit core360, CORE360BELT.com and use the code GESTALT for 10% off. Enjoy the episode. All right, everyone. Welcome to another episode of the Gestalt Education Show. We're starting our tour of Vegas today with the one and only Brandon Steele. We're here at Caesar's Palace. Had a good day so far, and we haven't opened the champagne yet, but we're going to get to that. But anyway, we're here for Parker Vegas. Brandon just spoke this morning. Brett was earlier today. Everyone from Michael Phelps to Mark Hyman this weekend. Holy cow. So if there's one thing that Bill Morgan does well, it is seminars. That's for dang sure.
He's got that figured out.
He's got this one figured out. So anyway, let's get to it. So Brandon Steele, co-owner, co-founder of ChiroUp. You do practice, though.
I do.
People don't know this about you, but you're a savage clinician, ttoo. And so,
first
and
foremost.
That's right. So let's kind of start with ChiroUp. When did this all start, you and Tim? And where was the necessity or what was the necessity that drove it?
What void were you filling in the profession?
We weren't. It was out of pure laziness on our end. We have a practice over in Swansea, right out of St. Louis, and I was just tired of telling patients the same thing over and over again. You give them an exercise, and they come back in on Monday, they're doing a freaking squat, and you gave them cervical retractions, and you can only tell so many people how to sit up properly or how to do something, and they go home and they don't understand what you're giving them.
Right.
So just an automated way to get that process rolling. But it's probably 2012 that we wrote it out on and it was literally a piece of construction paper of what we just wanted. And
how did you and Tim meet? Were you guys classmates or not?
Was that subtle big?
No, I'm serious.
No. I don't know. I was actually a CIHP. That's good. And I don't know how we met. He had a guy leaving for Canada. He was looking for a guy to fill a role, and I was kind of there. Kind of a fairy tale story.
I love it. Yeah.
He's a good person. If you've never met Tim.
Well, I think you guys are a good team. You have different skill sets, and
you need that.
Like any partnership.
Yeah.
One of the things that I see so often is you get an associate or an independent contractor is a bad deal. However, Tim's he's never guided me in a certain direction. Is like, listen, you take care of the patients. I don't care how you do it, and as long as you do it, the side effect is getting paid.
Mm-hmm.
And I just always appreciate that about him, and just that ability to not really care how we get things done, just get the result.
Absolutely. So the cool thing with the ChiroUp too is that now, it started out, it sounds like an automated way to get patients their exercises and to kind of keep them on track. But now, you've got everything from statistical analysis for chiros to financial analysis to we heard some rumors. I know on paper cut. We heard some rumors of the future of ChiroUp, of some things that you're working on right now and stuff. And so that evolution has been awesome to see. But are you evolving to fill a need, like Brett was saying, or is it just kind of evolving on its own and taking off next?
It evolves based on our subscribers. However, our subscribers have the same needs that you have.
Yeah.
Brett, you have. It's you have overhead. And you have revenue. So you can get revenue, you can decrease overhead, which is a way to do it. You can automate a lot of those processes, or you can make more money. So ChiroUp is based around, how are we going to let doctors practice, meaning be in the treatment room, treat patients, and not have to worry about everything else. The simple fact is we have to worry about scheduling. You were just on the phone texting the patient. Tired of that stuff. So how can we have a doctor not have to worry about collections, not have to worry about marketing to that patient once they leave, about bringing patients in, doing disability scores, worrying about their notes. How can we just make that a seamless process that I don't have to do anything on the weekend? I can just enjoy my life.
Yeah. And you're a doer too, Brandon. Like that is what's so awesome about you and Tim together.
Tim is a doer.
You are. You don't give yourself enough credit for that. But I think the way it's evolved, it's been pretty fascinating. But so maybe talk about let's talk about marketing just a little bit, because I love what you said yesterday about that marketing to the patient after they've left. And so how do you see that happening? And how have you designed ChiroUp to do that?
Those campaigns aren't in production yet. As far as a drip campaign.
Well, maybe not ChiroUp. How about just you, Brandon Steele, as a clinician or as a practice owner? Like, how do you continue to get patients through the door that maybe have fallen off or that kind of stuff?
Without like doing stuff we know, because people don't want to do stuff that makes it feel. Like a spinal screening or all the crazy stuff that happens in our profession. So, how do you do it in a tasteful way?
I don't, and that's the honest answer. So the only thing that we do is we have 2 medical physician groups in our area, and with those groups that we tell them what we do. The main thing is what we do and why we do it. They don't most of our chiropractors don't know what we do and why we do it.
Right.
So when you have the research behind that, and then you can give them the statistics and say, here's what we do, here's why we do it, and here's the results we get per diagnosis. Maybe that's a fault of ours. We don't do any reactivations. We don't go after patients. Our goals is, if I could get every single patient out of pain in one visit, we're in Vegas right now, there'd be a line from Vegas to St. Louis to see me, which I know is impossible. I get that. However, so as long as you do a good job, they're always going to come back and see you. One of the things that I'm always curious about is chiropractors keep patients for life. I'd get so bored with those patients. So you have to have the ability to get them out of pain, and then if they have a new problem, to understand what you do in your practice, so they want to come back and see you.
I love it. And then go ahead.
I was just going to ask. So, is ChiroUp evolved into something different than what you originally thought that it was going to be?
Yes, I thought it was a weekend project, and now I'm roped into this freaking company that.
Now you're in TD.
I've got people in Australia and Norway calling me, and I'm like, "What? Yeah, no, it's not." So it's a weird situation, and it's a very grateful and humbling situation. Then when you walk in a place like Parker, a lot of people, and they want to be around you. So I really appreciate the opportunity to kind of be the spokesman for if chiropractor A in Vegas wants to see this functionality complete, and it's going to help him practice, that he can email me and we turn it into reality. Not every practice can have a coder. You can't have a marketer.
Well, I had a whole new respect for you. I don't remember this. Years ago, I think it was Wisconsin, I was doing one of the state associations, and you were literally working a booth for ChiroUp. And I think that's what you were saying as far as being a doer. There are integrators and doers in the world. You are absolutely... that told me a lot about you, that you're willing to do that, and now you have people working your booth, of course. But I just think that was a testament to you as a human being, probably.
I never ever want to do that again.
Nobody wants to.
What the hardest thing to do is when someone tells you they don't want you anymore. So when someone churns or doesn't use our software as a service. So we have an extremely low churn rate. Someone who says they don't want to be a part of us anymore. I think we're at 1.9%, so not a lot of people, discontinue our service. But we take that to heart. In fact, we give them a call or we email them, depending on the person, and say, "Hey, we failed you. We told you we're going to give you this value. You couldn't see that value. Where did we go wrong?"
Right.
And then you get some pretty candid responses.
Yeah, sure.
And that's where we build from. To say, "Hey, we didn't solve that need. We don't lock them in a contracts, that kind of stuff." So we can just learn from those people. I learn more from those people than I do from anyone else.
How is diving into what you have dove into with ChiroUp changed your clinical practice? Is there anything that you've maybe changed the way you treat or added? I'm sure as much research as you guys pour over, it's made changes. But what are kind of like the things that people wouldn't think about that has maybe changed your practice?
Let me backstep. I don't think people understand the research that we do. Because I'm not a researcher, and Tim's not a researcher. We actually have a team with three chiros who go over between 300 and 500 articles per month and bring it down to 50. Actually, Terry Elder now, So they take it and give it to Terry. And then what Terry does, and he is, I mean, if anybody knows Terry, he's been on, I mean,
the Silver Fox.
He can, what people don't realize is some of those things change our protocols. Well, some of those things are good on a Facebook post. Some of those need to be an MD newsletter. Some of those things need an attorney newsletter. Some of those things are just a good new orthopedic exam or a good manipulation, whatever it may be. So then we take everything that's coming out this month and we turn it into reality. So if you look at a knowledge transfer system like Up to Date, that's still behind. People are talking about writing. I had a guy come in and said, "We should write a book." I'm like, "Why the fuck would I write a book? Who reads books?" And I was like, "I've got an up-to-date piece of material right here that you can access anytime that has this many people putting new research in front of you at all times. And not only if it's a new exercise, it's not just for us, it's going to those patients. That's crazy. That kind of pipeline is neat. To answer your question, though, I love...
Nice tangent, bro.
I love when I learn new information. I learned about like the C sign, for like stupid orthopedic tests that can differentiate hip to a back problem. You learn about BPPV, sleeping on the opposite side. Betty always sleeps on this side. I always sleep on this side. If you just have them switch sides they sleep on, you can help with their BPPV. It's those little nuggets.
Would your spouse actually be okay with that? I mean, like if we switched where like Sherry and I slept in our bed, I think she would murder me.
I'd say screw it.
That's like your place at the dinner table. You can't. Some stuff you just can't. No, let's be honest.
Yeah, I'll just live with the dizziness.
Yeah, that's right.
Yeah, I'll be vertiginous for the rest of my life. No big deal. So, how many active clients do you have right now? This number is staggering. I remember I heard this number about a year ago, and it blew my mind.
I'd say we're between 22 and 2,300.
Yeah,
that is awesome. Yeah.
It's a growing group of just like-minded people, and I really appreciate our subscribers. And I think that most of them would give you the same response. Is that we listen. If there is anything, we have a megaphone on top of ChiroUp. If they have a problem, some people hit it a little too much. If they have a suggestion, and while we can't do everything, we have a log. We have a checklist of things that we have to get done. If we hear about it enough, that shit gets done. I mean, we've got a team of coders that some stuff doesn't work well for the group, meaning we have to kind of reserve that. But if someone really needs something, we have a couple of big groups and hospital systems that use now that we can roll out functionality for that specific subset and not roll it out to the rest of the ChiroUp group.
Since you're gathering all this data with all these really good evidence-based chiropractors, do you think at some point you would take this data and maybe go to like a third-party payer and say, like we're definitely giving this level of care and we're costing you less money, and would you be potentially...
That's a yes.
That's a soft yes.
Yeah, so, I think...
because you're gathering the data already, right? So,
we've had those conversations, and I think that even this weekend, you have conversations with reputable companies and people, and everybody wants to do business together, or even like a podcast, or they want their information for this or that, or to do business with or sell this product. We have a very simplistic mindset that, listen, if it's going to elevate and unite the evidence-based chiropractic profession, we're in, whatever it is. And
because our profession's so weird, because you actually get rewarded by doing the wrong thing financially. If you're gonna play the insurance game, so it's kind of hard to find other analogies in life where you actually that's how
get
it
penalized
is. You get penalized for actually doing the better thing or the great thing. It's kind of
seeing your patients less, doing more active stuff.
But isn't that interesting that the marker in today's society is money? And obviously, we can say that. And my first year in practice is the worst year of my entire life of struggling to make money. I get it. I understand it. I'm not, but that's not what gives us our satisfaction.
Yeah.
If you go after money, that's an insatiable need. That's not going to work in life. I find that when I talk to people that's not their want. They may say it is, but their want is more time. It's legitimacy. It's to increase non-surgical, non-pharmacological care. If you want to unite the profession, say that. If you want to go after The profession, yeah, I think economics could create a schism in the profession if we want to create laws around it. But no, I think.
What do you think? You and I have talked before about like the IMC model. We've had Mark Miller on here before, where you would basically give someone a diagnosis, and then they would basically give you a case rate for, let's say you have a low back disc herniation. Well, that is worth $1,100. We cut you a check for $1,100, and then you can see him 2 times or you can see him 30 times, but this is the amount you're making. So there's talks in our world of like that's maybe one of the only ways to reward people for doing, a great job and not overutilizing resources.
I don't know if I'm allowed to do this. Winchester Spine and Sport, that model goes into effect on Monday. What happens to your P&L?
What do you mean?
Is that a good thing? Is that a good deal for you?
I'm just we've talked a lot about with.
Did he just?
No, I see all sides of it. I'm not necessarily saying it's a great thing. I'm just saying, that might. I'm trying to think of ways that would reward people for doing a great job and not overutilizing. That's IMC models. That's not mine. But I'm just throwing it out there. What do you think?
I think that if you take, and we've got some people who are young in the profession. If that model went into play on Monday, the only chiropractors that are going to make it are the ones that made it anyway. The gritty. They're going to find a solution for that.
Right.
That model goes into effect on Monday. Your practice is going to thrive. The other 7 around it are going to dwindle because they can't handle that. So bring it on. And I think that, and I say this in jest, but someone says, who's the better chiropractor? And I would say, I am. And I said, well, here's my stats. What are yours? Well, nobody has freaking stats. So they've got, and we can all have our own opinions if our ego's big enough. But if you truly have facts and you have things about, hey, for plantar fasciitis, on a 30-day average, I see them on average 6.9 times. They're 97% better. At least we have something. If a third-party administrator comes to me and says, how much should we pay you? I'm not going to say $1,000. I'm going to say, well, no, it takes this many visits, and here's our average.
On average, there's outliers.
Absolutely. So, but let's make this fair. But we have to have stats, and I don't know of a lot of companies that are doing that, or at least doing it for the right reasons.
Mm-hmm.
Right.
Mm-hmm. Yeah, I think that's a hard part thing too, of getting people to maybe take stats. So maybe give our listeners, give me some motivation on what things I should be tracking in my practice, or things that are actually like useful analytics that I can apply to make changes.
We have a couple, but I would say that it comes down to one. So if you look at the future success of a healthcare company, there's one question that's the only one that determines that. It's the Net Promoter Score. So if I have Peter walks out of my office and I say, Peter, how likely are you to refer Dr. Steele to a friend? 0 to 10. And if it's a 9 or 10, Peter's a promoter of your practice. If it's a 6 or 7, we have a neutral. Anything that below that is a detractor. You just need promoters of your practice.
Mm-hmm.
So that's the difference, though. That's the difference of going to get your oil changed and be like, well, yeah, they changed my oil. They did a good job there. I'm neutral. I'm not going to go on Google and give the Dobbs Tire and Auto a positive review. They did exactly what I paid them to do. But now if they did extra stuff and did a great job, then I'm telling every single person about this practice. So, our average, in fact, we did that for Kevin Christie, and he's gonna.
Who's he?
He's this guy down in Florida.
Superstar. I love that guy.
He's phenomenal. But we did the Net Promoter Score for just of CSA members that are also ChiroUp members, and theirs was something crazy. It was like 93, something like that.
Holy smokes.
Let me put that in perspective. Let me just throw these numbers out there as a brag to what he does with his
subtle
people.
brag, common guys.
To him.
Brag.
Yeah, to Kevin's group.
Yeah.
Is that if you look at the 4 seasons, I think it's like 38.
Wow.
They're in the 38-40. Now, Net Promoter Score is plus 100 to minus 100.
Mm-hmm.
They're at 93, plus 93. That is absurdly high. The rest of our group, I think, is about the 88, 89. Well, there's data right there. We just did a research study last 18 months or 24 months, I forgot. We put out 650,000 condition reports. That's what everybody's putting out to their patients, and now we can gather stats on that. At least there's some numbers on. I'm not saying that there's problems with all data. However, we can see what is the likelihood refer, what is the patient satisfaction. Here's a good one for you. What are the most common diagnoses the chiropractors made? You would think it'd be like sprains, strains. It's the functional stuff: upper cross syndrome, lower cross syndrome, scapular dyskinesis, those kind of things. So you kind of see a shift in the way people are understanding and treating if you just measure it.
Yeah.
There's an old saying: "In God we trust. Everyone else bring data." So what I want to know, though,
Country Notre Dame. I think that's the way that one.
Notre Dame.
How do you? So you're trusting your clients and your doctors a lot to make sure they get the diagnosis right. So let me just walk you through a scenario. You have lateral elbow pain. So lateral elbow pain could be an elbow derangement. It could be true tendinopathy. It could be radial nerve entrapment. So how do you, in your model, sort your way through like an actual diagnosis, if they might not even have the diagnosis right? Like, how do you reconcile those thoughts for those things?
I'll tell you what. I mean, we're gonna have this conversation, but we're gonna draw this out for the people who are not being able to see this. So I think we've talked about this before, but if you have a pattern of intake and you have 12 things that someone intakes and it comes down to a diagnosis, you're inherently faulted by that diagnosis, because that diagnosis is based on the provider's understanding, their education,
right,
their payment model of what they need to diagnose and what they need to do, as far as to make ends meet. And then they create some treatments based upon that. So imagine having an intake system with AI built in, that now the patient selects their hand, their forearm, and their elbow, along with numbness and tingling. And instead of saying, oh, they might have a cervical radiculopathy, asking the proper questions, understanding those things are probably neurologic, asking them a DASH score versus a neck disability index, and then cueing the provider to say, did you try the resisted long finger extension test? Did you do a radial nerve tension test? That'd be a system that I'd buy.
Right.
Got it. So you're basically just subtly hinting them towards what it would be. Like, hey, don't forget this, don't forget this. It's almost like a little bit of a help desk along those lines, if I'm hearing you right.
Yeah, I think so. I mean,
and you're getting away from like calling it something.
You have to look at a pattern of intake and go after those things. Meaning, I don't really care. I mean, I honestly, this may sound bad, but if you have symptoms along the radial, we're just going to use that, radial nerve distribution, I don't know if it really matters with tendinitis, tendinosis. Do some radial nerve flossing.
Or rule out the cervical spine, or that way you could kind of like algorithm it a little bit.
And I know I'm on the wrong podcast for this, but man, when I see someone with all the letters behind the name, I just want to block them from my cell phone. I'm like, so anybody, I always get in trouble because I don't put any initials behind my name. Now, with that being said, man, if you took away manipulation, things like Mackenzie, that's powerful, nerve flossing. However, I don't really care. I don't get in the weeds. I wish I was. Maybe I'm wrong, but I really think that and you have to have those. You have to manual therapy is critical, and I think it's tremendous. But I don't think one is better than the other.
Right.
I think that if you want to be a master, you have to be a master at something, whether it's, what was the old, like NIMO or ART or Grasp. I don't buy it. I don't think one's better than the other one. I think it's the confidence of the provider. It's their attention to detail, them asking the right questions, and them giving the person a plan to get them out of pain that's more important than the actual therapy. With that being said, we got to get joints back to moving, full range of motion. I mean, I'm still a chiropractor at heart, but as far as the individual techniques, I'm not a technique guru.
Yeah, makes sense. I mean, we honestly aren't too. We have our functional triage. We talk about different things, but at the end of the day, I mean, whatever you're getting results. I think at the end of the day, what Brett and you would agree with this as well is like your assessment is so important. So whatever your assessment is, I mean, how are you integrating your assessment into your treatment? You know, like how are you getting from point A to point B?
Well, the best clinicians in the world too, like they're just taking all of these shortcuts, like that, and that's what I think you're trying to bulletproof yourself on, which would be like if you don't have 20 years of experience, this is the checklist you go to. What's hard is like a seasoned, veteran, if you will, is you walk into a treatment room and you've seen it so many times, you just kind of know. So like you're naturally taking shortcuts, and it becomes very tough to teach because it's kind of a little bit of an intangible, really, And to me, it's like it's no different than anyone else. Like in different professions, it's you're able to gather the information and then you make really good decisions. It's like a really good emergency room. Like they're able to triage really well. We're not saving lives really, but well, maybe we are. But you know what I'm saying? Like you're just able to like gather the information, make good decisions according to that. And I think like a lot of people, I hate to say this, they're just not good at doing that. So because they just mindlessly go through their day, like they don't understand the interrelationships of the kinetic chain, the body, and therefore they're no better at the end of the day than they were in the beginning of the day. Instead of just like exponentially just getting better.
There's a paper came out, I think it was Chang, PM&R, just this year about exercise, which is, it is what it is. So for acute things, let's call it things.
Yeah.
You can tell them to go freaking do cartwheels.
Right.
Yeah.
Do whatever the hell you want. Get some exercise in. For chronic pain, you need to be given specific stuff. However, yeah, I would agree with you. Creating technology that can understand a seasoned chiropractor's mind is impossible because you can go through so many steps. I go through when I did McKenzie classes, I was like, just well, we're going to start with this step, then go to this step, and just blow it up and move on. It's like, what's the worst going to happen? Just blow through it.
Right.
So you do take shortcuts. But here's the point, is that you can, not you, I would estimate that you can automate 99% of the patient-doctor care in office. And people are like, well, no, you can't. McGill, every patient's a case study one. Absolutely. However, if you're spending 15 minutes on that 99%, you forgot about the 1%. You forgot about what's in that patient's history, where they went last weekend, why their back pain hurt. You didn't talk about them at their wedding and falling over and doing keg stands. You were so worried about going through your rigmarole as far as how you care for patients that you have to automate a certain portion of what you do so you can really hone in and get to the bottom of where that patient's at and solve their problem.
Appropriate because we're in Vegas, but it's kind of like gambling a little bit because you've seen something a million times and you know that 80% of the time when I did this, I get a result. So why the hell would you not push your chips into the 80%, And I think young clinicians especially, like they really struggle with just the low-hanging fruit. There is so many acute low back cases. If you just would get out of your way and give them 10 press-ups and manipulate them, like you're off and running. But you overthink it. You're spending too much time with them. You're over-educating. And I just see that mistake a lot.
And I think I 100% agree. And there's a humility aspect of it. That if someone told me that what I was doing was wrong and there's maybe a better way to do it, there's a little bit of pride built in there. I'm like, no, I learned this from this person and this is the best way to do it. Well, no, you can just probably do something a little bit easier. And people kind of get locked in their habits of treatment and education. That you got to continually make that adaptation to meet your patient's needs.
To me too, there's so much brilliance in simplicity. Like at this point in my life, like when you were the same way. When we're young, you're all about making things complex and difficult.
We're not tailored or anything, but
we're all becoming a pile of dust. Let's be honest. But anyway, so you know what I'm saying? It's.
We talked about it last night. Maybe we don't remember, but. The scripts that we're talking about.
Yeah.
And this sounds so bad. But my conversation with I used to like have scripts. So I'd go through all the everything that happens in a joint problem, joint restriction. Patients don't give a shit about that. Now I'm
I
like,
would love
listen,
to hear you go through that.
you want to hear it is now? Like, listen, Sally. I've got a job to do. I need to get things moving. And I hold up one finger. You need to keep things moving. Those are the exercises I'm giving you. And you need to keep things moving for a period of time, depending on the tissue. You know, I need to give a prognosis. If you're broken bone, it's going to be 4 weeks. If you have a sprain strain, it's going to be 10 days to 14 days. And as long as we can do that, we can get you out of pain. So here's what I'm going to do. I'm going to do manipulation, myofascial release, and all that kind of stuff. Number one, you're going to do what? I'm going to do the exercise you gave. Yes, you're going to keep things moving. And we're going to give it how long? About 2 weeks. Great. And then I just build in my adherence off that.
Yeah, that's awesome.
that's
so
perfect.
simplistic. And we're in Missouri. So you got 5th grade language,
Oh, yeah.
6th grade language. If you get above that, you've lost that patient.
How important is it for you? I mean, your company's growing. You potentially down the road might not need to be in private practice, but how important is it that you keep yourself in private practice to stay up with everything?
I don't know how to say this properly, but if tomorrow I had to make a decision, I'd be in private practice. There's no ifs, ands, or buts. You take away everything else and give me a patient in the room on Monday, and I'm happy as could be. I backed down a little bit just because of the demands of life. So I practice 2.5 days now versus every day of the week. And the demands of life, my freaking shoulders and feet can't take it any longer. But we still run a very busy practice, and I would never, ever, ever trade that for the world. I get invited to weddings. I have patients who bring their babies in. I mean, there's no greater joy in life than solving people's problems.
Right.
And you are a part of that problem, a part of that process. So yeah, I'll always be in practice.
Well, I'm the same way. I just feel like, I mean, don't get me wrong, for humanity, you still want to be helping people, but also, like, at least for me, there is such a game within a game that, like, I'm playing with myself, and that just, like, gets me through my day where for me, it's about checking audits and, like, being able to change all these audits within the patient, like.
I'm going to do that so I can't.
Yeah, we get a little bit longer there.
I agree. I think, too, it's always awesome to – you're a great presenter, Brandon, but you bring so many clinical clinical experience, into your teaching, which I think is a really important thing to maintain. If you're going to be an educator, you need to be applying this stuff daily. That way you can come up with shortcuts, or you can talk about when you're changing
One thing
things.
he's not good at is pouring champagne. My gosh.
Jesus. I listen to every single one of these podcasts. Every single one of the podcasts. And I always think, like Larner's pod, I had like a freaking sheet of paper. I'm going to talk about this. If I ever get on this podcast, I'm going to talk about this person, this person, and this person. If there's one thing that the last one you just did with, we just talked about last night. Aaron.
Yeah.
He shared the Tony Robbins quote, and it was, knowledge without, purpose is pretty much useless. So if I'm going to give a talk, and today's talk was an hour, most of my talks are 8 to 12 hours. Personal record, I think, was Alaska, was like 16 hours.
Oh, man.
And oh my God. That's just information. You can't remember all that kind of stuff. People want to be a master of metabolic syndromes, plantar fasciitis, and cervical joint. That's not freaking possible. So you have to give someone something to do on Monday. It's a little bit different. So the way we do our lectures is just based on here's how to assess it, here's how to treat it, and here's what you're going to do differently. And we kind of habit stack that if you want someone to change their habits, you have to give them a little bite-sized piece of here's how to make that change. If you don't want to make it, don't make it. That's fine. Right. But if you do, then obviously we can be a part of that.
Love it. Awesome, man. Anything else, Brett?
No, I think we were telling a good story last night. We were in Naples together. I mean, this is a long time ago. And Stu McGill was there, co-lives. This is like an amazing weekend. And we talked Stu into going swimming out in the ocean. It was literally, remember, it was like the coldest day in Florida, like in the history of Florida. It was cold, 25 degrees. So like 2 o'clock in the morning, we get out in the ocean and of course go in there. And do you remember running back to the house? We were dying. But
so just in context, I used to live in North Carolina. and we were going deep sea fishing. We're jumping up one of those big, I mean, you can't even see land, one of those big buoys that has, lights going off for whatever reason. So we weren't catching any fish, so we were just jumping up. It's like 20 feet in the air, just having a great time. We're like 12, 14 years old. And we jumped back in the boat. About 15 minutes later, a great white pulls up next to our boat. It was probably bigger than our boat. You're looking at about 15, 16-foot great white. And I was like, I'm never going back in that thing ever again. So here's the deal. If you want to go in the ocean, when do you go in the ocean? You definitely don't go in at night. And I was like, there's no way I'm going in the ocean at night. But took advantage of that, and I got a great picture. And I got the best advice ever that weekend. And I learned a lot from Dr. Skaggs. Tremendous. I did a year with him. Him and Jim George run a phenomenal outfit at CHP. Obviously, with you, great mentorship. But Stu McGill gave me the best advice, and he probably doesn't remember me. And I asked him, and I said, "Hey, how'd you get into speaking?" I'm a 1 year out. I'm a nobody. How'd you get into the speaking, deal? And he said, someone asked me to speak, and if you stink things up, they're just not going to invite you back. And I was like, yeah. So then you start to get your name out there, and some people invite you back.
Yeah.
Some people don't. That's just fine.
Yeah, definitely. We'll for sure be inviting you back because we have a trip planned to the ChiroUp headquarters, and we got to sit down with you and Tim together, and so we'll be looking forward to that one for sure. So,
how would you, in a sentence or two, sum up what ChiroUp is for our listeners? Like, what exactly is the service that you're offering?
It's a knowledge transfer system. It's a way for providers to get the best up-to-date information for 112 different diagnoses. And then the most important part is, how do you deliver everything that you know about a condition to the patient? That's the hardest part. Mm-hmm. How do you educate the patient as much as you do? An educated patient is a compliant patient. If they understand their condition just as much as you do, which you can customize everything in ChiroUp, then they're going to figure out how to help themselves just as much as you want to help them. Mm-hmm. So we do that in email, print, app format. Exercises, ADLs, all the different things you want to educate a patient. We do it in an automated fashion to help you see more patients. And
it's a monthly subscription. That's how you do it? Mm-hmm. Yep. Do you want to tell people how much it is, or
we'll just where to find them?
No, it's $149 a month. I'm not afraid of that. I think it's a huge bargain.
Yeah,
I want to bump up that price every single month. And
that's a Brandon Steele. Do you guys see what I just did?
Yeah, that's good.
But you know what? Here's the deal, though. There's no contracts, there's no commitments, there's no termination fees, there's no anything. Meaning, if we're not giving you value, quit us. That's fine. Yeah. We have 1.9% of people who say it's not for me. That's fine. That's and then we can learn from that. However, the rest of the people are like, yeah, this is something that's giving me value.
Mm-hmm. That's awesome.
Well, thank you for everything you do for the profession. Thank you for the friendship. Yeah, this has just been amazing.
ChiroUp.com, right?
Is that what you named it?
Check it. We're getting off this damn podcast. All right, Brandon, thanks for being here, brother. Great job. Man, we love following you, and you guys are just doing awesome stuff.
Back to the sports book.
Yeah, back to the sports book. All right, guys. Have a good day. Thanks again. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.